Exercise 9 deals with the muscular system. So in this PowerPoint presentation, it's just going to show various pictures of the body, starting with the full body and then moving more detailed from the head down to the feet. Going through different muscles. Once again, use your lab manual with the list of muscles that you're required to know, because you're not required to know all of them. That would just be crazy. So use that lab manual as a guide to highlight or write down which muscles you need to know. Once again, repetition, practice, that's what's going to help you to learn them. Do not be concerned about the points of origin and insertion, that's the attachment points. For the muscles, just be able to identify the muscles. You'll notice a lot of the names are by the location or how many heads or ends that it has to it. And so once again, you're going to see where those anatomical terms that you learned at the beginning are helpful. They come back into play. Keep in mind that on your exams that you do not have to know the spelling. You'll basically be given a word bank and a picture, sort of like a matching. Can you identify, this muscle? Tell me which letter it corresponds to on a label diagram. So don't be panicking that you're going to have a diagram and lines pointing to a muscle and completely out of the blue you have to come up with it. No, you will have a word bank for this course. So as you can see on this first slide, we do have some of the major muscles marked. Keep in mind as well that for some of the muscles, there may be two words. Don't use the common layman's terms. Use the name of the muscle as we know it, because that's going to keep you from basically getting yourself in trouble. One example of this is over here with the Biceps Brachii. Please use the full name, because there's also a triceps brachii. So I want to know that if you just say brachii, well, which one are you talking about? Let me know that. So we have over here both the front and the back view. Biceps, don't just say biceps, because there's also a biceps femoris. Well, where do you think the biceps femoris is versus the biceps brachii? Brachii refers to arm, femoris to the thigh region. So keep those things in mind as well. When you look at muscles in the head, first starting with those that give some of the facial expressions, you'll notice that, once again, some of the names, the occipital frontalis muscle, the frontalis is the frontal portion, the occipital is the back portion of it. Orbicularis, you have two different ones. Orbicularis oculi, that refers to the muscle surrounding the eye, versus the orbicularis oris, which is surrounding the mouth. Muscles that move the lower jaw, remember that mandible is the only movable bone in basically the head. So you've got some that are involved with this, such as the temporalis. Where is that going to be? Look over the temporal region. You already know the temporal bone. The masseter is another one that helps to move that jaw up and down. You have several different muscles that help to move the tongue. Glossus refers to the tongue. You have a lot of muscles in the neck to allow you to move your head up and down, to allow you to move your head side to side. So get pictures of these that are unlabeled, put them on a plastic sleeve, and then just start labeling. Then practice. Erase it, label again, practice, erase it again. The sternocleidomastoid is a major muscle with the neck. As you can see, it's labeled right here. That helps with turning the neck. The trapezius is along the back of the neck and then extends down towards the back. additional from different viewpoint here. You have several different muscles along the back. And once again, this is just going to take moving or practice, or sometimes actually to help learn muscles, movement. See which muscle's moving when you make a certain movement, and then just practice labeling over and over and over. Some of the muscles along the abdomen area. Look at the orientation as to which direction the muscle fibers are moving to help you learn them, and also the orientation. You'll notice some of them are in layers. So what's on the outermost layer, and then as you move in the upper abdomen and thoracic area, you have the pectoralis major along the back, the latissimus dorsi. You have the serraceous muscles. These are the muscles that look like right over here. Almost look like feathers on there. The external obliques. The linea alba looks like this line right down the middle here. You've got the rectus abdominis on either side of that. Now, when you look over here, the external obliques, which are right here, as we showed earlier, in this enlarged diagram, look at the orientation of the fibers. There's just below those are the internal obliques. The fibers are moving in the opposite direction. And then below that is the transverse abdominis, where the muscles are now moving this way. It makes it much, much stronger to have the fibers in different layers moving in different directions. It allows for different range of motions, but it also helps to strengthen it quite a bit too. Another view of some of your more internal muscles. The diaphragm is a muscle. Remember, that's the muscle that is separating your thoracic cavity from your abdominal pelvic cavity. You do have blood vessels such as the descending aorta and your inferior vena cava that have to pass through that. The esophagus has to pass through it. So there are openings that allow for that. Intercostal muscles are between, coastal refers to ribs. Once again, look at the orientation of the fibers and the wording. External is going to be outer, internal obviously is going to be beneath that. Those help with breathing, so you're going to see that with the respiratory system. You have several different muscles along the pelvic floor and muscles along the perineum. When you look at your shoulder, that pectoral girdle, as we mentioned with joints, that the range of motion is greater, but you have a lot of muscles there that are helping to stabilize that joint. So once again, layer of this. Just a moment. I apologize for that interruption. I obviously have a cat that was not happy. So with the helping to move the humerus of the upper arm, you're going to involve some of the muscles, such as the deltoid, which is right here on the shoulder. And then as you move down the arm also, you've got things such as the triceps brachii, as we move down here, you've got the triceps brachii, you've got the teres major, latissimus dorsi, as I just said, the deltoid. So you have several different muscles depending on what type of movement determines which ones are relaxing, which ones are contracting to allow for the movement. Not all of the muscles are going to be contracted at the same time. It depends. Are you moving the arm forward? Are you moving the arm up? Are you moving it back? Are you doing a rotational type of movement? So once again, as I mentioned earlier, biceps brachii, triceps brachii. Make sure you use the full name. As we move down the forearm, you have the brachioradialis. Well, that's going to tell you upper arm radialis to the radial bone. Flexor, carpe radialis. Some of these are telling you what type of movement you're going to see, such as flexion. I know there are a lot. Easiest thing to do is to find a starting point that makes sense to you, and then, okay, I know this muscle, then this one, then this one. So you have your starting point or your landmark and move from there. And remember, you're looking at both sides of the arm, both the anterior and posterior, both the front and the back. There are a few muscles that do extend down into the hand. Once again, you don't have to know all of these muscles. Use the list that's present in the lab manual to help you with that. The muscles of the hip and the thigh, as we're moving down the leg now, muscles in the thigh and the hip are going to help stabilize that hip joint, that pelvic joint, and then also allow movement of the leg. One very good landmark for the thigh is the sartorius muscle right here. It's this one that goes at this angle up like this. And then right on the front view or the anterior view, this large muscle right here is the rectus femoris. Then you have the vastus lateralis, the vastus medialis. Use those directional terms to help you. Remember, medial is towards the midline, lateral is away from the midline. And then as you move deeper, and on the posterior view, and then the lower leg, excuse me, on the lower leg, once again, find the starting point. You see a lot of the names relate to what bone is attached to. It's related to what type of movement is an extension. In this diagram, they have cut the gastrocnemius muscle, which is up here. This would be the large muscle that would extend on the surface right here on the back of the lower leg. The soleus is below that. And then in the foot as well, there are a few muscles that do extend down. Once again, go back and look at the list of which ones you're responsible for knowing, and then just practice, practice, practice.